All over the fitness world, we hear time and time again, you should be drinking as much water as you can. Then on the opposite side of that, you hear people say, well, don't drink too much water because that makes your kidneys work harder and you could damage your kidneys. So how much water should you be drinking, and what does the data actually show? Your kidneys actually monitor the amount of sodium and potassium inside the body and work along with those levels in order to either increase more urine or decrease the amount of urine that your body outputs. So how much water can you actually take that your kidneys can filter? Well, your kidneys can actually filter 800 to 1,000 milliliters of water every hour. That's about 0.21 to 0.26 gallons an hour. Over a 24-hour period, that's about 6 gallons. However, there are some notable conditions where you should definitely not be drinking this much water. Things like heart disease and congestive heart failure and kidney disorders, as well as some metabolic disorders, cause issues if you're drinking more than a gallon or even a liter of water a day. So you really need to talk to your doctor if you have those sort of diseases to find out how much water is really healthy a day to drink. So how much water should you actually be drinking a day in order to keep your body in tip-top shape and running as best as it possibly could? It's about 120 ounces a day, which is roughly 90% of a gallon. So almost a gallon of water you should be drinking a day to really keep your body in tip-top shape. Lastly, you see in the news everything about water intoxication or water death. And what that is it's not actually death due to water. It's death due to water reducing the sodium amount in the body. So your body has a certain amount of salt inside of it that can be increased or decreased based off of what type of foods you eat, what type of medications you're taking, etc. Now, if you're drinking a lot of fluids that don't have any electrolytes in it, what it does is dilutes your sodium and lowers that level in the body. That lowered level of sodium, called hyponatremia, can cause a lot of different issues, including brain edema, including fluid filling up your lungs, including different problems with your spinal column. All these different things can cause issues. Who are the main people at risk for decreased sodium? The main people at risk are going to be those who have psychosis, or and that's psychiatric disorders that actually make them think that they're thirsty, so they drink way more water than usual. People who are extreme sports, so bodybuilding is definitely going to be a big one. Lots of hiking or extreme, long distance running is going to be the issues causing low sodium. There's people using diuretics as well as different recreational drugs such as ecstasy. Those things can all really dehydrate the body, lowering the sodium in the body, causing hyponatremia. So, if you're a competitor, what you need to make sure you're doing is keeping salt in your diet. Yes, that means even during peak week. In terms of water, you want to make sure that after your show, you're drinking something with electrolytes in it. Gatorade, Powerade, stuff like that that's going to give you sodium, as well as drinking normal water with that. That's going to slowly rehydrate yourself, and so you do not have to worry about keeping your sodium low by over drinking too much water. Things like ecstasy and stuff like that, just don't do it. You're going to do it anyways, but make sure you're hydrated with some sort of electrolytes or things like that. Thank you for watching. I appreciate your support. If you have any questions, you can DM me, message me, email me. I appreciate everything. Have a good one.